Good morning, my loves. Happy Monday. Beautiful day here at the lake. Currently 60 degrees. The high today is 90. It's really nice. And it's really, really bright, which is why I'm not sitting in my usual position. It's super bright today. Today, we are discussing core wounds. You may or may not know what those are. I'm sure you have heard the term. And I'm going to explain it in the simplest of terms. We have all experienced something at some point in our life that has absolutely cut you to the core, to the very core of your being. It may have been something you experienced, an accident, an illness. It may have been something that somebody said to you that was just absolutely horrific, that you just can't imagine they would ever say that. That's a core wound. They start accumulating as soon as you're born. I remember things said to me. I have an excellent memory. I remember things said to me when I was 3 and 4 years old that were just horrific, horrible, horrible things that were said to me. Now, the individual that said them to me has passed. Even if they hadn't passed, they probably wouldn't care that they said it. That's just who they are. They would be of the get over it mindset. But to a child that was a little toddler that was 3 or 4 years old, that was horrible. That hurt so bad. And the adults don't care if you're a child. They just tell you to suck it up, get over it, walk it off. But as a child, you can't do that. So you carry that core wound with you the rest of your life until you get into therapy and you heal the core wound. It may be something that happened later in life. It could be a divorce, a breakup, any number of things. Losing a job, losing your home, losing a child. You know, those are deep wounds. And so often we, especially if it's something that happened in childhood, you blame yourself. If you're a victim of domestic violence, you may carry the guilt and blame yourself. If you're a victim of rape, sexual assault, trafficking, again, you may blame yourself. So you have the core wound, and then you have the guilt that you should have handled it better, you should never have done this or that. That's just compounding the wound. And so we start at birth, and I'm 66. Trust me, there have been some core wounds, but I learned how to handle it, how to deal with it, how to face it, how to heal. And that's the service that I offer. That's the service that a lot of counselors offer, that a lot of therapists, psychologists, psychiatrists offer. If you're dealing with core wounds, please get the help that you need, because things happen in everyday life that will trigger those core wounds. It might be something somebody says. It might be a fragrance for veterans, somebody that's been involved in a violent crime. The smell of, what do I want to say? Like fireworks, gunpowder can trigger them. The sound of fireworks can trigger them. For somebody that's been assaulted, somebody's fragrance may trigger you because of the fragrance that your assailant was wearing. Somebody touching you a certain way can trigger you. Now, when you're triggered, especially if it happened when you were a child, you're an adult now and you're triggered all of a sudden, and you kind of have a bit of a flashback, that reaction, and all that guilt, everything floods back. And even though you're 40, 45, 50 years old today, when you're triggered, you experience it all over again as the ages when it happened. So for a split second, you're 4 years old again, you're 5 years old, at the same age as you were when you were the victim to that core wound. And it's really hard for people because you're an adult now. It happened when you're a child and you're overreacting. People say you're overreacting, you're lashing out. It's because when you're triggered, you just automatically revert back to the age of the wound. We need to heal the wound. For, like I said, victims of violent crime, assault, rape, there's so much guilt associated with that. And you need to understand, especially if you're a child, baby, you handled the situation the best that you could, considering you were a child. A child being sexually assaulted being beaten or raped, abused. When you're 5, there's not a lot you can do. You dealt with it the best that you could. Do not blame yourself. You are not to blame for how someone that is an adult handled the situation. It's a them thing, not a you thing. And I don't care how often they say it's your fault, you brought this on. If you're a victim of domestic violence and your abuser says, you brought this on, you pushed my buttons, you know saying this or cooking this, you know if I come home in a bad mood. Honey, that's a them thing, not a you thing. Do not take on that guilt. Don't take on the guilt. And it's something that we can work through. Again, get in therapy. You are worthy of healing and having a happy life. You don't have to go around carrying all the core wounds. You can set them down. There are things you can say and do, affirmations, but you need to be in therapy because we have to dig down deep and get to the actual wound, what happened and how it happened and why it happened. You may not even know, if you were really tiny, you may not even know why it happened. It just happened. But it's not your fault, okay? If it is something that you brought on yourself, and that does happen, people that are involved in gangs, people that are in prostitution, sometimes, they've sort of brought that on themselves. If you're a prostitute dressing a certain way, selling your body, yeah, you have to admit you have some culpability in that. You may have had to go into that to support your kids, to put food on the table, but again, there's enough blame to go around. You're not the one that beat yourself, threatened yourself, cut yourself, whatever it is. So admit your culpability, but, you're not the abuser. I go through this a lot with veterans because they knew when they signed up, honey, you're a soldier, you may be going into combat. And what really hurts me is when they come back, somebody that has been in combat, especially snipers, because I have had through the years several clients that were snipers. They come back and they're a different person. And they carry a lot of guilt because people will tell them to walk it off. Get over it. It's over. It's done with. Put it away. It doesn't work like that. Because you came back a different person with core wounds and moral injury, PTSD that runs so deep. So deep. But through therapy, it can be dealt with. I don't want people self-medicating. That is not going to get you anywhere. That's just going to compound the problem. So turning to drugs, turning to alcohol, gambling, sex, porn, whatever, that's not going to fix the problem. You need to get into therapy. You really do. But we can address it. And yeah, as a soldier, you signed up for the job. It's like a police officer. This is part of your job. But put the guilt down, okay? Put the guilt down. You didn't bring it on yourself. This was your job, just like this is my job. But don't blame yourself. Don't carry the guilt. Because I have had veterans tell me what things their family has said to them. What did you expect when you went to war? That the family didn't deserve being treated like this when they came back. Well, honey, the veteran didn't deserve to be treated the way they're being treated either, So that's why veterans and their families need to get into individual counseling and couples counseling, family counseling to work through these situations. But there are answers out there. There is healing out there. I promise you. Families that have gone through traumatic situations, individuals need to go into therapy, but so does the family, because you all interact. So it's not just a me problem and a them problem, it's an us problem sometimes. As well as people newly diagnosed with cancer. It's not just the patient, it's the family. It affects everybody. And so often it's a good idea, especially if it's terminal or chronic, leukemias, multiple myelomas, for the individual to get into therapy, but for the family to get into therapy as well, because, you know, everybody's going to have to deal with this. Terminal patients, yeah, they definitely need to get into therapy because there's a lot that they're having to face. They may or may not have a support group, that family standing behind them, friends in their corner. And the family probably needs to get into some therapy, because so often you hear of family members dying and it's like, oh my gosh, what are we going to do? How am I going to handle this? Well, honey, how are they going to handle it? They're the one dying. So, and those again are core wounds. When you hear that your mom's dying, your dad's dying, your sister, your brother, your child, that's a core wound for both of you. Let's get everyone the help that they need to deal with the core wound, to deal with the triggers, and to be able to live a happy, healthy life. It can happen. And admitting, yeah, we need to get into therapy. That's very courageous and very brave. It's not a sign of weakness. It doesn't matter if you're talking to clergy, you're talking to a therapist, you're talking to a psychiatrist, a psychologist, your family doctor. It's brave to go in and say, hey, I need help with something. That takes a lot of courage. And you have to stick with it. You're going to have good days and you're going to have horrible days, because it's going to stir up a lot of pain, a lot of yucky stuff. But it's worth it, because you're worth it. You're worth healing. The situation is worth healing. Just some things to think about. Core wounds, triggers, trauma, drama, and counseling. Give it some thought.